So I want to make everyone aware that breast cancer is a very important health concern for women. Breast cancer, unfortunately, is very common. 1 in 8 women in their lifetime will get breast cancer. But the good news is that we have this incredible screening test that can detect breast cancer very early. Early cancers, when detected, are very small. They are not palpable or felt by patients. So they have the highest chance of cure. And the treatment that is needed to cure these cancers is less aggressive and causes less morbidity. So I encourage women to take charge of their health and get their screening mammograms. The recommendation is to get screening mammograms starting at age 40 and getting them every year. But mind you, if you have a higher risk for developing breast cancer, which can be because of many reasons, your family history, the density of your breast, if you're overweight and other reproductive and hormonal factors, then your risk for breast cancer is higher and you will benefit from additional screening as well as early screening with tests like MRI. So I encourage women to talk to your doctor about your health by the age of 25 and really find out where you are with your risk for breast cancer. And if you are higher risk, then you will benefit from screening not just at 40, but even earlier with additional tests. But most importantly, screening saves lives. And if you can get screening every year, starting at the age of 40, you have the highest chance of saving your life from breast cancer. And how it does not really hurt you. The risks are minimal. The most risk you get from a screening test is it's a little uncomfortable. And it, of course, causes some anxiety. But the benefit of finding a tiny cancer and saving your life from breast cancer far, far outweighs those little risks. So please, I encourage you, get your annual screening mammogram starting at age 40 and talk to your doctor about your risk. What drives me? The ability for early detection and diagnosis of breast cancer. I chose this field because I want to encourage and educate women about the benefits of screening and how it plays a role in saving your lives from breast cancer.
Welcome to Indian Women News. Our guest today is Pragya Dang. She is Chief of Breast Imaging at Newton-Wellesley Hospital. She will be honored as one of the Outstanding Women of the Year this year on March 8th. At Burlington Marriott Hotel. We are going to talk to her about her journey, and also through her, we are going to create an awareness about how important is breast screening. Pragya, welcome to our studio.
Thank you, Pendraji, for having me. It's an honor to be here.
Excellent. We are really being honored as well because, what a great job you are doing and creating an awareness for the breast cancer is incredible. So it's Women of the Year, Breast Cancer Awareness, and also on March 8th, this is the International Women of the Year Day, I think, too. So there's a lot of things that have really coincided.
Thank you, and I am grateful. I am so grateful to be recognized on such an important event for women. And, I devote my career and my life to the betterment of the health of women. So I am so grateful to be recognized here alongside all these amazing women.
Perfect. So now, off the camera, you were saying that 1 out of 8 women will get a breast cancer. No questions asked. But the good news is that if they are diagnosed at the right time and the treatment is provided, 99% chances are they will survive the breast cancer. That's a great news. So now let's start with you. What is your role at Newton-Wellesley? And tell us what you do and what is happening in Newton-Wellesley Hospital.
Great, thank you. Yes, you are right. Unfortunately, breast cancer is a big concern in women. As you said, 1 in 8 lifetime risk for developing breast cancer, which is 13% of the women. But as you said, the great news is that we have this incredible screening test that can detect these breast cancers when they're very small and they're not palpable. You cannot feel them. And when you detect these little cancers, they have a much higher chance of cure. And even the treatment that is needed to cure them is less extensive, less aggressive, and less morbidity with them. So I encourage women to get screening mammography, and screening, the guidelines say start at age 40 and get a screening mammogram every year if you're an average risk woman. That would give you the highest chance to fight this cancer. My role, this is what drew me to my field in breast imaging. So I'm a breast imaging radiologist by training, and I've been in the Boston MGB system throughout. And currently, I am the section chief of breast imaging at Newton-Wellesley Hospital. So my job includes interpreting screening mammograms, but other mammograms too, doing breast imaging, image-guided procedures such as biopsies, localizations. I also read breast ultrasounds, breast MRI exams. So my whole focus is on breast cancer, and the main focus for all of this is early detection and diagnosis of breast cancer.
So, Pragya, now my question is, some might ask you some really stupid questions, but okay.
It's all about raising awareness.
Okay.
Yeah.
So the first question is, there is always, hesitation among women or even men also for certain things to go and see a physician or get checkup done because they're scared or somebody might find something, and I want to avoid that. How risky is that behavior, especially when it comes to breast cancer?
So you're right. It is understandable. Healthcare is scary. You're scared to get a test. You don't know what to expect. What are the risks associated with it? And just coming out, unfortunately, especially in our community, cancer, breast health, women's health is still somewhat of a taboo. If you actually go in rural India and some of the other areas, there's just not enough awareness. Unfortunately, when women truly present is when they have this advanced cancer and they've kept it under wraps or covers for a while. But I want to encourage, we live in a country where we're so fortunate. We have this robust screening program, Medicare, Medicaid, everyone covers an annual screening mammogram. So I encourage women to not be scared. It's such a minimally risk exam, and the benefits are just far, far outweighing the risk of you dying from breast cancer. All it needs is you need to go in. We take a few pictures of your breast. The x-rays associated with it are minuscule. They're like your background radiation. So it is not a risky test. And again, the benefit, as I mentioned, it picks cancers that are small and completely curable if they are picked at an early stage, and they require minimal treatment or less aggressive treatment. So yes, there is an anxiety associated with this. There's the fear of the unknown. And of course, there is a little bit of discomfort when you're getting a mammogram, but the benefit is so high. I truly, truly encourage women and empower them to, understand the risks from breast cancer and take that action to save your life from breast cancer by getting this one test, small test that you get annually. There are other things about breast cancer screening too. There is this fear that one of the risks that are described is the anxiety that is associated. Sometimes when we read a mammogram, we see findings that may not be real. And we call you back, and all it requires is for women to come back for us to take some additional pictures, maybe even do a procedure and figure out if there is a breast cancer or not. So a lot of these turn out to be negative and nothing, but it's important for us to better be safe than sorry and identify these little cancers. And yes, that is an inconvenience that causes anxiety, but that anxiety is short-lived. And again, the benefit of finding a small cancer is so much higher because it saves your lives from cancer.
So now somehow this 99% survival has stuck in my head. So if the chances are, even if you are diagnosed with a cancer and if you are 99% chances are that you will survive, there is no risk with getting the screening done. Everybody should just go and say, look, I want to get tested because long-term survival is much better than...
Absolutely. And you're so right. Unfortunately, there are so many myths in the media for people. They're scared of getting this test. They talk about this term called false positives. But what is false positives? We're not finding things that are not cancer and telling people they have cancer. No, we are just finding certain things which we work up. And if they turn out to be normal, that's excellent news. So that's the risk. The other risk is, yes, there may be some biopsies when we perform these procedures, the results are negative. in the sense they're great results. They are not cancer, but that's what we're striving and hoping for, to find these things that are not cancer. In the small chance that we do detect the cancer. So yes, these are procedures that they're not truly unnecessary. They are needed to make sure someone does not have a cancer and the finding that they have is benign. These are minimally invasive procedure, very low risk procedures. So yes, there are a small percentage of women who would need these additional pictures, these additional procedures. But these are very minimally invasive procedures, and they are so low risk in the big advantage that if we do detect a small cancer, as I mentioned, small cancer, almost near 100% cure rate.
Sure. Yeah, sure.
Long-term survival.
Now, I have also heard that also men also get some sort of breast cancer. So if you can just talk about that.
Absolutely. So breast cancer is not a disease that is exclusively seen in women. Men do get breast cancer. So men do not have a screening program unless they have a genetic mutation. So if you have a very strong family history of breast cancer in many first degree relatives, or sometimes even just sporadic, men can get breast cancer.
So what percentage of men are likely?
It's a very small percentage, but it isn't unheard of. So if men feel a lump in their breast, or if they have a finding, they should not ignore it. Breast cancer is not outside the realm of possibilities. And if you do have a finding, you should present to your doctor. You should get the appropriate imaging tests. And again, detected early is treatable.
Excellent. Now, so you are reading mammogram and you suddenly see that, there is a risk, there is a possibility of this developing into a cancer. What happens after that? How do you call the patient, or how do you deal with that, if you can talk about that?
Absolutely. So there are typically two ways of mammography. One is a woman is asymptomatic. They're taking care of preventative health and they're getting screening mammograms. They come, they get the mammogram and they leave. When we read these mammograms, if we see a finding, we bring the women back. And typically a department will call the women, and 10% of women, 1 out of 10 women who get a screening mammogram, even if they're asymptomatic, may have a finding in them. That doesn't mean all of these are cancer. Some of them are worked up, some additional pictures are needed, and majority of them turn out not to be cancer. But 10% of women are called back for some additional workup and pictures, and about 1 to 2% of them end up getting biopsies, and they could have a tiny cancer that they don't feel. And as I mentioned, once picked up, it is easy to treat because it's tiny. The other part is women who feel a lump, or men who feel a lump or have a symptom. They come to us directly for additional pictures as well. We'll do a mammogram, we'll potentially do an ultrasound. And if there is a finding, we will biopsy it, and then we take it from there. So yes, that's the way the process works. We call the women and then we spend time with them.
So
we explain them.
So if they get a second call from you, they should not become nervous.
No, especially if you get a call. 10% women from screening, and I want to emphasize 1 out of 10 will get called back. But that does not mean that they have a cancer. That means we just need to work something up, and we want to make sure there's nothing wrong with their breast. And 1 to 2% of those will end up getting biopsies, but even those biopsies, 75% will be benign. So don't get afraid. And the whole idea is we're trying to find something that is little. Even though majority of these are negative or benign, there is a small percentage that could be cancer. But the goal is, if there is cancer, let's catch it early and let's take care of it.
And even if they have a cancer, there is a hope because the medicine. So how much advancement the healthcare has made in treating breast cancer?
It's incredible. We've come a long way. The treatments are so great, and breast cancer is really, really curable if picked at the right stage and if it is the right type of breast cancer. So it's amazing. The advancement in medicine are great, and what helps with decreasing this mortality is also breast cancer screening. We have a robust program. We have decades of evidence that shows that since mammography was implemented as a screening tool, the survival rate is so high from breast cancer. So along with a robust screening program, women coming to get mammograms, detecting cancers early, and the advances in treatment, it's been amazing.
And the screening program was introduced only about in 90s, right?
In the late 80s, early 90s, yes. And you can see that graph coming down, that the lives, 40 to 50% mortality reduction in breast cancer since then, which is amazing.
Which is amazing, yes.
Yeah.
And the medicine also have improved.
Yes, significantly. The treatment and the medication, the oncology is great. Advances in treatment, of course, has helped greatly in taking care of treating this breast cancer, and we're helping them by detecting it early so it's more effective and less aggressive.
So now in America, there is a study for everything. So my question to you is, have there been any ethnic studies about the breast cancer, like people, African Americans or South Asians or Caucasian? Is there any study like that who is more likely to have that or no?
Yes, absolutely. As you said, there is a study, and that's what excites me about medicine. Unfortunately, we are seeing that African American women, as well as we already know for years, Ashkenazi Jewish women really have a high risk. Being African American or Ashkenazi Jewish elevates your risk for developing breast cancer.
What about South Asians or Indians?
South Asian Indians also have, but I don't think we have that robust data to say that they are at a higher risk than an average woman. I think there are many factors that play into your risk, but the real evidence that we have is for Ashkenazi Jewish and now slowly developing for African American. Unfortunately, African American women are being noted to have younger cancer at a younger age, more aggressive cancers. So one thing which I say to all women, and guidelines now by the College of Radiology too, is talk to your doctor about your risk. There are many, many factors that elevate your risk for developing breast cancer. So just by virtue of being a woman and aging, your risk for breast cancer is increasing, as I mentioned. But along with that, many lifestyle factors. If you are overweight, if you have too many alcoholic beverages in a week, if you are a smoker, if you have a family history of breast cancer, if you have someone who has a genetic mutation that increases your risk for cancer, all these factors increase your risk for breast cancer. So we encourage women that they should talk about their breast cancer risk with their doctors at the age of 25 and see the women who actually have a higher risk for developing breast cancer may need screening even earlier than age 40.
Pragya, what is the youngest breast cancer patient you have seen or you have heard of who got it?
Unfortunately, me personally, I've seen a 19-year-old with breast cancer. I know it sounds shocking.
It sounds shocking, yeah.
Yes, it's unfortunate, but also I have to say that the population that I have encountered is obviously a higher risk population. We live in the greater Boston area. People are aware of their health and they are in charge of their health. And also I've worked and trained at Mass General, and I worked as faculty there for a few years. So, and then at the Brigham. So these are both tertiary care academic centers where we've seen the most complicated and advanced cases. So unfortunately, just by virtue of age, if you are in your teens or 20s, yes, it is less common, but it isn't unheard of and it does happen. We are seeing a lot of young women in their 30s, unfortunately, with breast cancer too.
How we can reduce the risk of breast cancer?
And this is great. There are many lifestyle modification factors, and this is why I encourage women that, you should talk about your risk with your physicians to understand what factors increase your risk. As I had mentioned, lifestyle, alcohol, weight, and some factors that are not in your control, right? Whether you've had children or, various reproductive factors as well. So everything contributes to your risk. Talk to your doctor about your risk, understand where you lie. And one more thing that I want to emphasize is if you truly are a high risk patient, I encourage patients to know what their risk is, because if you are high risk, if your lifetime risk is greater than 20%, that's the data we quote, then you benefit from additional screening, not just mammograms, but other tests such as breast MRIs.
So who is the high risk patient for the
high risk? Some of the factors to think about is if you have a family history of breast cancer, if you have a first degree relative, your mother, your sister, your first aunt with breast cancer, if you yourself have been diagnosed with a genetic mutation that increases your risk for breast cancer. And along with those, there are other things, breast density, if you have more glandular tissue, if you are overweight, and there are many factors. They all sort of add up. It's a big puzzle, various pieces to it, and they should add up to tell you what your risk is. So when women have a formal risk assessment by a breast specialist, or most OBGYNs and doctors do that too, they'll know what their risk is. And if their lifetime risk is greater than 20%, then that's when they benefit from early screening, earlier than 40, and additional screening such as breast MRI, in some cases ultrasound and other tests.
What about this? So we talked about the youngest. You said that the teen you had done. What about the oldest woman? Age wise, can also get breast cancer.
You can get breast cancer at any age, and obviously by virtue of age, the older you get, the chances of getting any cancer increases, and breast cancer is in that spectrum. Many people ask me, when do you stop screening? So screening should not be stopped by virtue of age. There were guidelines say stop at 70s or stop at 75, but life expectancy is increasing. So why would you take away the chance of saving your life and living another couple decades if you are healthy, if you don't have a lot of comorbidities? So we say the decision to stop screening for breast cancer should not be by virtue of age. It should be a discussion with your provider. How is your overall health status? What are your guiding principles? What are your goals for life? If you can tolerate the additional procedure that I can do, then why not take that tiny breast cancer? Why would you want to die from that? So we don't stop screening by virtue of age. And as women get older, the chances of getting cancer increases. So talk to your doctor and see how you are and how your overall health is. That should be a factor.
Now, all these different type of cancers related, or they can be just very localized? This
is a great question. To some extent, we understand certain syndromes where cancers are related. There are different types of syndromes. There are certain syndromes, when you have a BRCA mutation, that increases your risk for breast cancer and ovarian cancer. There's a strong association. Women who have genetic predisposition, they have a predisposition to ovarian and breast together. But then there are many other syndromes. Li-Fraumeni, Cowden are some technical syndromes that I'm talking about, where many cancers together can present in different family members as well. So yes, some cancers are related and some cancers are isolated.
Okay. Now, let's talk enough about medicine and breast cancer. Now let's have some fun. So who is Pragya Dang?
Pragya Dang, that's a big question. That might take way more than a second.
I want to hear from you, yes. How do you, tell us about something which is, you know better than anybody else.
Sure. So I can start with my journey. I grew up in India, born and raised to a family of 2 doctors, and that was sort of my natural progression.
So your mother and father both were
doctors? Both of them are physicians. My dad was a family physician, and my mother is a retired OBGYN. Both of them practiced in India, and I was just inspired
in Delhi?
Yes, in Delhi. I was inspired by their life. That's what helped me decide to go into medicine. It was a very rewarding career, a rewarding profession, and I saw how selflessly they took care of patients. So that was very inspiring to me. So that's how I decided to go into medicine. The sciences is what excites me. The data, the research, the science, and the science behind the human body was fascinating. So that's where I decided to go into medicine. And as I went into medicine, I was exposed to radiology, and the problem solving in radiology is what excited me about radiology. I felt a radiologist was a doctor's doctor. When you get sick, the first thing you need is an X-ray, an image to tell the specialist to guide their treatment. What is wrong with the patient? So that's what I loved about radiology, and that's what I decided to take. I moved after medical school to the United States in 2006. And I was first told, you can take the easy path. Most foreign medical graduates will do medicine. And then after, medicine, they can specialize. But I wanted to take a little bit more of a challenge. Radiology excited me. I wanted to do that. But, there were encouraging mentors and people along the way. But there was also a lot of discouragement that this is too competitive. And to add to all of that, my family was in Boston. My husband was in Boston. And to get into the greater Boston hospitals was next to impossible. So I took a harder path. I spent a couple years. I did a lot of research, and I was very fortunate to get incredible mentors who guided me through the way. And I'm so thankful to them. They presented me with the opportunities, and I think I took it from there. But I couldn't have done it all without my parents, my role models, but also the support of my husband. I moved here, we got married, and I had his 100% support. And I think he plays a huge role in who I am. We live in Lexington. We have 2 daughters. And I think he and even his family, here. I was married into a family who were so supportive of my career and everything I did. So I was very fortunate to have the best people around me, my cheerleaders, as well as all the opportunities.
Well, the Dangs were also the community cheerleaders as well. So I think they have done a great job.
I'm very, very lucky and
Sure.
fortunate. And then I took on from there. I trained at MGH. I practiced there. And I did my breast imaging training there as well. And then I was chief resident when I was the resident. So during MGH residency, and all of that was very exciting. And, as my father always encouraged me, hard work pays off. So it was all about hard work and working hard.
So here's another question for you. Who named you Pragya? It was your father or your mother? Or somebody else?
I think they claim it was together. So it was both my parents, I think.
So I think the Pragya is one of the most beautiful names. And also, if you go by the Indian mythology, I think the Pragya is the essence of Indian philosophy. That's what exactly it is. So, wonderful, great name. And whoever, your mother and father, congratulations for that.
Thank you. That's very flattering. And somewhere up there where my father is, unfortunately, he passed away. He's smiling up there.
Yes,
I think.
Sorry to hear that. Yeah. But another question is, as I was reading your answers to all the questions we had asked you, as I was reading, I could see your father's face everywhere there, There is so much impact he had in you, on you. So tell us about him, that who was he and how he had such a big impact on you?
That's a wonderful question and very close to my heart. I think I am who I am because of my father. He shaped me into who I am from the very beginning.
And what was his name?
Vijay Kumar Ahuja.
Okay.
Yeah, Dr. Vijay Ahuja. Everyone knew him as Dr. Ahuja. He was my inspiration to get into medicine, and he was my strongest cheerleader, but he was also my biggest critic. He pushed me, always pushed me to go above and beyond, But the one thing he always said, strive for the stars, but always have your feet on the ground. So that's who he was. He was a dedicated physician. He spent his whole life, dedicated his whole life towards taking care of his patients, who were his number one priority. But along with that, there was a lot of other stuff he did for the community, which was very inspiring. He believed strongly in education. He always told me education doesn't go to waste. So I constantly strive to keep learning in my life. Because of him, he supported children's education in India. He was a chairman of a government-aided school for underprivileged girls. He was a chairman of the Child Education Society in India. And that was all alongside of his responsibilities of being a physician, a full-time physician. And along with that, he was a sociable personality. He loved music, and he's the one who instilled the joy of music in me. He was an incredible friend. There was never a time if anybody made a phone call to Dr. Ahuja, he would be there for them. And despite all these roles and responsibilities, he was a true family man, and he taught me the value of family. He was an incredible husband to my mother, of course, and he was such a doting father to me as well as my sister. And we're all physicians. He taught us to be who we are.
Your sister is also a physician?
My sister is a physician. Everyone in my family is a physician except for my husband, who we call the black sheep or the only sane one. But yes, he was a doting father to my sister and I, and absolutely, he was a mentor for my husband. My husband says that he misses him more than I do. They used to talk their finances and the stock market and everything every single day from India and here. So he was just the central pillar of our family, and he taught me the value of hard work, education, supporting our community, the joy for music, as well as just my love for my family.
And what drives Pragya Dang? What is the driving force?
I mean, there are multiple aspects. I think I'm very passionate about my work, my joy, and the difference that I make in women's life. I am very, very focused on raising awareness. So I cannot thank you enough for this platform to raise awareness to women about such an important health issue. I am passionate about focusing on, encouraging and empowering women to take charge of their health to understand the benefits of something like breast cancer screening, which gives them the highest chance of saving their lives from such an important health issue, breast cancer. I actually participate in a lot of community events for that. I want to educate women. So, I speak with the community, my colleagues, my co-physicians, my technologists, but mainly the women in the community about this healthcare concern. Along with that, just my overall profession, I want to provide high quality breast imaging accessible care. We talked about anxiety earlier, right? So my mission has been, when I came to Newton-Wellesley, the idea was to bring that highest level of care to Newton-Wellesley so that we can provide the same quality. People don't have to go into the city. They can come to the community and get the same level of care. And that sort of aligns with the MGB mission, that we want to provide the same level of care without people trucking themselves into the city. And the other thing is, I don't want women to wait. It's very anxiety provoking to get a test and then say, oh, we need to figure out if this is cancer or not. And then you need to get a procedure. So our goal is to take care of them in a timely way. We look at our access. We make sure women can get their care right away. We read the screening mammograms in just 24 hours. And we do their procedures sometimes the same day as well, because I want to reduce that anxiety. And that's the kind of section I built. I brought all these fellowship-trained, subspecialized breast imager to provide that high-quality, accessible care. So that's very important to me, the quality of the work we do, the care that we take care of the women, and how we can empower and educate women to take care of their health. So those are the things professionally that I enjoy. But personally, my family is very important to me too. I mean, I think the joy of my family is equally important as the joys I get in my profession, and their happiness, their joy, their excitement, and hopefully I can shape my girls with the same values that
and
I
you
was
have
raised.
two daughters, right?
I have 2 daughters. They're 10 and Anya is 10 and Ava is 7. And it's fun, it's exciting, and it's busy.
Excellent. Pragya, thank you so much.
Of course.
And we'll see you on March 8th.
Thank you so much for having me, and I'm so honored and grateful.
Very good.